I was diagnosed with fibromyalgia and also with Meniere syndrome. So my quality of health was pretty bad. They call it the fibro fog or the Meniere's fog, but lots of pain, flu-like symptoms, terrible dizziness, inability to get out of bed in the morning. All those things made my quality of life pretty awful. At the same time, I worked a full job, but yeah, it was very, very difficult. It actually came through one of my religious sisters. So she was very ill, much sicker than I was, and she lived in one of our convents that's in southern Illinois. And I saw her in the summer and I really worried about her. She was so miserable. And then I went back at Christmas time and she was a new woman. She had no pain, she was happy. And I said to her, "Oh my gosh, what did you do?" And she said, "I went to a chiropractor." And I went, "I don't believe it. I don't believe in chiropractic." And she said, "No, you have to come with me and see." So it was an upper cervical chiropractor. And I went with her, saw the whole adjustment, and then he did a scan of my neck just because I was there, and he went, "Oh yeah, we can help you." But I lived here in the Pittsburgh area, so he recommended Dr. Bulow. And so I called the office and Dr. Bulow actually answered the phone, which was a shock. And he said, "Well, you'll see, we do our practice a little bit differently here." So I came and yes, it was a wonderful experience with him. He's so professional, but he's such a good man, comes through as well. So in the beginning it was intense, more than once a week, but it was certainly worth it. And then I recommended it to many other people, and yeah, so I was one of his early patients, but very grateful that I found him and that the chiropractor in Illinois recommended him. It's totally different than any other doctor visit. So the scans, the adjustment, the x-rays, all of those things, lots of questions. I knew he was listening, but it was a great experience. I have to say that I rarely have symptoms from either condition. They do come back, that's just life. They're not really curable, either one of them. And so, but if you want to talk about quality of life, the ability to function, the lack of the fog that I was living in, the ability to pop out of bed in the morning, all of those things, that has been extraordinary. But I'm really convinced that I have to keep coming, instead of saying, "Well, I feel great, I'm not going to come." So I do believe in chiropractic now, and I do believe, that you have to be checked and see if the adjustments have to be made. I would say, take the chance, even to get examined, to see if maybe your symptoms could be alleviated and again, quality of life, that it would improve. I'd say run, and I do recommend it to other people. I recommend upper cervical, and that at least they try, because yeah, I was helped and I was totally skeptical in the beginning.